Hello friends, welcome to Ragsmed. Today we'll be studying about cranial nerves and nucleus or ganglion. So let's start with the cranial nerves. So there are 12 pairs of cranial nerves. Let's see one by one. Number 1 cranial nerve is known as olfactory nerve. Number 2 is known as optic nerve. Number 3 is known as oculomotor nerve. Number 4 is known as trochlear nerve. Number fifth is known as trigeminal nerve. Number six cranial nerve is known as abducens nerve. Number seventh cranial nerve is known as facial nerve. Number eight cranial nerve is known as vestibulocochlear nerve, also known as statoacoustic nerve. Number ninth cranial nerve is known as glossopharyngeal nerve. Number 10th cranial nerve is known as vagus nerve. 11 is known as accessory nerve and 12 is known as hypoglossal nerve. So these are the 12 pairs of cranial nerves. Those which are marked with red color are known as sensory nerve. So what's the function of sensory nerve? Its function is to take the sensations from receptor side to the brain. Like olfactory nerve, when we get a sensation of smell in the nose, the receptor present in the olfactory epithelium takes the sensation from olfactory nerve to the olfactory lobe of the brain. And optic nerve, the receptor present on retina takes the sensation of visual through optic nerve to the occipital lobe of the brain. Likewise, the vestibulocochlear nerve, it takes the sensation of hearing to the temporal lobe of the brain. And those which are marked with blue, such as 3, 4, 6, 11, 12 nerve, these are responsible for movement, such as oculomotor nerve, which is responsible for movement of eye muscle. And mixed nerve. So what are mixed nerves? This is nerve 5, 7, 9 and 10. And it has both sensory as well as motor function. Now talking about the origin of respective nerves, nerve 1 and 2, that is olfactory and optic nerve, originates from forebrain. Nerve 3 and 4, that is oculomotor and trochlear nerve, originates from the midbrain. Nerve 5, 6, 7, 8, that is trigeminal, abducens, facial and vestibulocochlear nerve, originates from the pons. And finally 9, 10, 11, 12, that is glossopharyngeal, vagus, accessory and hypoglossal nerve, originates from medulla oblongata. Now, what is afferent and efferent? Afferent means it takes the sensation to the brain, that is, it performs sensory functions. And efferent means it takes the sensation from brain to specific organ or muscle, that is, its function is motor. Now, before starting the topic of nucleus or ganglion, we should know that the cranial nerve may have one or more than one nucleus. Now let's start about the nucleus or ganglion. So nucleus or ganglion, it is a collection of cell bodies. If the collection of cell bodies is within the central nervous system, then it is known as nucleus. And if the collection of cell bodies it is within the peripheral nervous system, then it is known as ganglion. Here we can see this is the cytone or cell body and these are the axon. So there are 7 types of nucleus. Number 1 is GSE, that is general somatic efferent. Number 2, SVE, that is spatial visceral efferent. Number 3, GVE, that is general visceral efferent. These are motor, that is it perform motor functions. Number 4, SVA, that is spatial visceral afferent. Fifth, GVA, general visceral afferent. Sixth, GSA, that is general somatic afferent. And number 7th, SSA, that is spatial somatic afferent. These four perform the sensory functions. Now let's see all of the nucleus one by one. First, let's start with the first one, that is general somatic efferent, that is GSE. These nuclei supply skeletal muscles of somatic origin. So here, the cranial nerve involved are 3rd, 4th, 6th and 12th. So the nucleus of 3rd nerve, that is oculomotor nerve, is known as oculomotor nucleus. The nerve of 4th, that is trochlear nerve, is known as, its nucleus is known as trochlear nucleus. The nucleus of 6th nerve is known as abducens nucleus, and the nucleus of 12th nerve is known as hypoglossal nucleus. The oculomotor nucleus is present in the midbrain at the level of superior colliculus. Trochlear nucleus is present in the midbrain at the level of inferior colliculus. Abducens nucleus is present at the lower part of the pons, whereas hypoglossal nucleus is present in medulla. The oculomotor nucleus, its fiber enters oculomotor nerve and supplies 4½ extrinsic muscles of eyeball except lateral rectus and superior oblique. The trochlear nucleus supplies superior oblique muscle through trochlear nerve, and the abducens nucleus supplies lateral rectus muscle through abducens nerve. And the hypoglossal nucleus supplies 7 out of 8 muscles of the tongue through hypoglossal nerve except palatoglossus muscle. Now let's come to the second type of nucleus known as spatial visceral efferent, also known as branchial efferent nuclei. These nuclei supply striated muscles derived from pharyngeal arches. Here the cranial nerve involved are 5th, 7th, 9th and 10th. Also 11th nerve. So the 5th nerve nucleus is known as motor nucleus of trigeminal nerve, which is present in the upper part of the pons, and it supplies muscles of mastication through mandibular nerve. The nucleus of 7th nerve is known as motor nucleus of facial nerve, which is present in the lower part of the pons, and it supplies various muscles innervated by facial nerve. The 9th, 10th and 11th nerve nucleus is known as ambiguous, which is present in medulla, and it supplies stylopharyngeus muscle through 9th nerve, also known as glossopharyngeal nerve. Also, it supplies the muscles of soft palate, pharynx, larynx through vagus and cranial part of accessory nerve. Now, let's come to the third nucleus, that is known as general visceral efferent, also known as GVE. So, these are parasympathetic, which is preganglionic fiber and postganglionic fibers are present here, and it supplies smooth muscles and glands. Here the cranial nerve present are 3, 7, 9 and 10. So the nucleus of third cranial nerve is known as Indinger-Westphal nucleus, which is present in the midbrain in close relation with oculomotor nucleus. The cranial nerve 7 is superior salivatory nucleus and lacrimatory nucleus. Superior salivatory nucleus is present in the lower part of the pons, whereas lacrimatory nucleus is present in the pons. Ninth cranial nerve nucleus is known as inferior salivatory nucleus, which is present just below the superior salivatory nucleus, that is lower part of pons. And the 10th cranial nerve is known as dorsal nucleus of vagus. It is present in medulla. The third cranial nerve nucleus, which is integer vestibular nucleus, its fibers pass through oculomotor nerve to the ciliary ganglion to supply sphincter, pupil, and ciliarus muscle. Superior salivatory nucleus sends fibers through facial nerve to rely in the submandibular ganglion and supply submandibular, sublingual glands and glands of oral cavity. Lacrimetrine nucleus sends fibers through facial nerve and relay in pterygopalatine ganglion and supplies palatine, nasal, pharyngeal, and lacrimal glands. The inferior salivatory nucleus sends fibers through ninth nerve and relay in otic ganglion and supply parotid gland. The dorsal nucleus of vagus gives fibers through the vagus nerve to be distributed to the thoracic and abdominal viscera, which is here the ganglion's presence in walls of viscera. Now, let's talk about the fourth nuclei, which is spatial visceral afferent, and fifth nuclei, which is general visceral afferent. Here, the nucleus of tractus solitarius is present in the medulla. Its lower part receives GV, that is general visceral sensations, through ninth nerve from tonsil, pharynx, posterior part of the tongue, carotid body, and carotid sinus. Also through 10th nerve from pharynx, larynx, trachea, esophagus, and other thoracic and abdominal viscera. Whereas its upper part receives, that is SV, spatial visceral taste sensation from tongue, from anterior 2/3 of the tongue and palate except circumvallate through 7th nerve in its superior part, from posterior 1/3 of the tongue through 9th nerve including circumvallate papilla in middle part, from posterior most part of the tongue and epiglottis through 10th nerve in the inferior part. Now, let's talk about the sixth nucleus, that is general somatic afferent, also known as GSA. It is related to trigeminal nerve. Here, the cranial nerve present are 5th, 7th, 9th, and 10th cranial nerve. So, here the nuclei is only related to trigeminal nerve, that is 5th nerve. So, here you can see the nucleus of trigeminal nerve are main or superior sensory nucleus, spinal nucleus, and mesencephalic nucleus. The main or superior sensory nucleus lies in the upper part of the pons. Spinal nucleus lies in the medulla and it's of three parts. Number one is pars caudalis, which receive impulses of pain and temperature from the forehead. Second one is pars interpolaris, which receives impulses from cheek. Third one is pars oralis, which receives impulses from around mouth. And third nucleus is known as mesencephalic nucleus, which is present in the midbrain, and it's the only example of primary sensory neuron whose cell bodies lies within the CNS. These nuclei receives following fibers, that is exteroceptive sensations and proprioceptive sensations. Exteroceptive sensations is touch, pain, and temperature, and this is received from the face through 5th nerve and from the skin of auricle through 10th nerve and 7th nerve. Proprioceptive sensations is received from muscles of mastication, which reach mesencephalic nucleus through 5th nerve, and from ocular, facial, and lingual muscles, teeth, and temporomandibular joint. Now, finally, let's talk about the seventh nucleus that is known as spatial somatic efferent, that is SSA. Here, the cranial nerve involved is eighth nerve, and here are two nuclei, that is cochlear nuclei and vestibular nuclei. In the cochlear nuclei, there is dorsal and ventral part, and in the vestibular nuclei, there is superior, spinal, medial, and lateral part. The cochlear nuclei receive impulses of hearing through the cochlear nerve, whereas the vestibular nuclei receives fibers from semicircular canals, utricle and saccule through vestibular nerve. So here we finished about the cranial nerves and respective nuclei and ganglion. If you have any confusion, please let me know in the comment section. Thank you. Like, share and subscribe.